Right, okay, hi. So welcome to this NPTEL course entitled Feminist Writings, where we're looking at Sylvia Plath's poem Tulips. And in this session we'll conclude the poem and we'll hopefully make it as interactive as we possibly can. So just to go through what the poem does generally, it talks about agency-lessness and sensory experientiality in a medical space, where the human subject is essentially and increasingly commodified as an object of investigation, dissection, diagnosis, and where there's a very dramatic collapse of the economy of empathy. There's no empathy at all between the nurses who come in and go and the human patient who suffers in a very passive condition. So that kind of empathy-lessness is equated with agency-lessness. And also, I mean, if you want to push it further and make it into some kind of a real serious embodiment studies, there's a very interesting correlation to be made between empathy and agency. So a lot of current neuroscience studies tells us that we can only be agentic when we are experiencing an economy of empathy. When empathy goes away, that has a very adverse effect on the human agentic control at a motor level as well as as an extended level, right? So those of you interested in serious cognitive studies could possibly go down that direction. But for the purpose of this course, we are talking about embodiment in a very dialogic relationships, embodiment as an embedded condition, which is the neural, psychological, the visceral condition, and also embodiment as an extended condition in terms of its negotiations with the discursive apparatus around the human subject. Now, just to go to the final stanzas of this poem, if you take a look at what should be on the screen, where the speaker says, "Nobody watched me before, now I am watched." So the whole idea of being watched becomes important because it's a very direct reference and allusion to medical surveillance. She, as a human subject, has been watched, monitored, reified, cut down by the medical gaze, which is very impersonal and dehumanized in quality. So the medical gaze is quite reifying in quality. It makes her an object. She is watched. The tulips turn to me, and the window behind me, where once a day the light slowly widens and slowly thins. And I see myself flat, ridiculous, a cut paper shadow between the eye of the sun and the eyes of the tulips. And I have no face. I have wanted to efface myself. The vivid tulips eat my oxygen. So we talked about already how the window over here becomes a liminal space-time. It's a spatio-temporal signifier. It's not just a space, which it traditionally and literally is, but it's also a pointer to time, the passage of time. Because the window is only passage through which the human subject can experience time in a very indirect way. So she can see, she can experience the light of the sun coming in and dazing out, and that would determine a clock time for her, right? So the window becomes quite literally a liminal space-time frame, right? So talk about window being a space frame, it also becomes a time frame over here, a spatio-temporal frame, which is very liminal in quality. And once a day, the light slowly widens and slowly thins, right? So that determines day or night, the gradual widening of the light and the gradual thinning of the light, etc. And also important to see is how the tulips turn to her, right? The tulips are gazing at her. So the tulips become very much collusive with this medical gaze that she's experiencing already. The tulips become slightly monstrous in quality. And that again is very important because that is part of the defamiliarization package that a poem does. I mean, it converts traditional metaphors into uncanny metaphors, right? So tulips, flowers, which are traditionally metaphors of tranquility, reconciliation, perhaps romance as well, are all dramatically and deliberately defamiliarized into violent objects, objects of violence, objects of compassionlessness, etc. So the tulips become quite complicit and collusive with this reifying medical gaze that she's been subjected to at this point of time. And also interestingly is the idea of the flattened out body, right? And I see myself flat, ridiculous, a cut paper shadow. So the idea of flattening out, again, those of you interested in serious cognitive embodiment studies, you find this is a very common experience of loss of embodiment, the sense of being flattening out. And again, flattening out is a spatio-temporal phenomenon. It's not just a flattening out of space, the body as a space. It's also flattening out of the body as a movement in time. So you get a sense of liquidation of time, liquidation of space. So it's a very spatio-temporal phenomenon, the idea, the experience of getting flattened out, right? And that's a very classic trope of de-embodiment or disembodiment, loss of embodiment. So, and also the word ridiculous is interesting because that I may have mentioned this in class already, that is a very interesting pointer to an entanglement within two kinds of conditions which take place during disembodiment or de-embodiment. One is the experience of superficiality. You become superficial, that's the flattening out bit, and ridiculous makes you superfluous, right? So this combination of superficiality and superfluity coming together is very much part of the loss of the embodied density or the ontological density which makes you a human subject. And you end up being a cut paper shadow, right? So this whole idea of being a cut paper shadow, something quite absurdly meaningless in quality, becomes quite deliberately dramatized the way up. Between the eye of the sun and the eyes of the tulips, right? So again, we have two kinds of eyes in question, the eye of the sun, the eye of the tulips. We can do two readings of this. One reading is quite literal in quality. The eye of the sun over here is a window in the room. The eye of the tulips is the other end of the room. So she's stuck between two ends of the room. That's one reading. The other reading, equally possible, is looking at herself as being cut between two kinds of gaze, two orders of gaze. One macro order of gaze, the eye of the sun, and one more micro order of gaze, the eyes of the tulips. She's somewhat situated between these two orders of gaze in a very helpless, passive condition, right? So she's stuck between two kinds of gazes, as it were. So both readings, that they sort of agree on the claustrophobic quality of this kind of an existence. Right? So she's stuck in a room between a window and tulips, which are presumably by the wall. And also she's stuck in a situation of being cut down by two kinds of gaze, the macro gaze of the sun looking at her and the micro gaze of the tulips looking at her from inside the room. So the very intimate micro gaze and the massive macro gaze both cut her out as a human subject. And the next sentence, the next line is important as well. And I have no face. I've wanted to efface myself. So yesterday we talked about how there are two readings which are possible out of this. I have no face. I have wanted to efface myself. So face being the very interesting part of you, which is both the most public part of you and as well as the most private part of you. It is most public in the sense that it is the most extended part of your embodiment. It is what you are in a social space, and also it's the most private part of you because it is the most unique bit of your individuality and your identity. So the face becomes very interesting. Again, there's a degree of liminality about the embodiment performed by the face. It is the most public as well as the most private order of embodiment. So I have no face. I wanted to efface myself. Again, the whole idea of effacing yourself could be a symbolic illusion or a pointer to perhaps an intention of suicide or killing herself. I want to do away with myself. But equally, another valid reading would be I have wanted to efface myself away from this trauma of existence. And of course, we know that there's a biographical backdrop in the poem, the very spectral presence of the dead child, the unborn child, the miscarriage which he suffered, out of which this poem got written. So that also comes in a very interesting sense. And another reading, equally valid, would be I have no face, I've wanted to efface myself. And as we discussed in class yesterday, the whole idea of having a face could be a social construct. And I have no face now, I want to efface myself, could be a subversive strategy. I want to do away with all kinds of faces conferred to me. Right? So I want to move away from any kind of performance of face. I want to efface myself completely. So that can become an agentic aspiration. So both readings are equally valid at this point of time. And the last sentence over here is a direct pointer to the violence enacted by the tulips. The vivid tulips eat my oxygen. The whole idea of eating oxygen becomes important over here. Oxygen becomes a metaphor of lifeblood, vitality, the life spirit, which gets eaten up or consumed by the tulips. So the whole idea of consumption becomes quite viscerally depicted in this poem at this point of time. Okay, so, and then we have further descriptions of what the tulips are, where the tulips come from, and the psychological effect, the visceral effect tulips have had on this human subject. Before they came, the air was calm enough, coming and going breath by breath without any fuss. Then the tulips filled it up like a loud noise. Now the air snags and eddies around them the way a river snags and eddies around a sunken rust-red engine. Now this metaphor is interesting because all the time, everything before that is very natural, organic, idyllic in quality, and suddenly we have this rust-red engine. There's an alliteration about it, rust-red, a degree of decadence, a degree of violence perhaps. And we know the word red, the color red, becomes quite symbolic in the context of this poem. It becomes a pointer to a bodily wound, which is perhaps connectable to her experience of miscarriage, and also the redness of the tulips, and they're sort of dialoguing with each other in a very unsettling psychological way. But interestingly, what we see over here is the organicity and the idyllic quality of the rivers, the air snagging and eddying, etc., suddenly juxtaposed with this artificial machine, this decadent rust-red machine, the engine, coming together. And that is obviously a very, very potent description of medical experience, especially in a clinical space, because in a medical space, the human being doesn't remain organic entirely. The human being becomes supported by machines. The human being becomes entangled with machines. So in that sense, any medical experience is an entanglement with the machine, right? Whether it could be a life-supporting machine, it could be a life-giving machine, it could be a ventilating machine, it could be any kind of machine. But the human being essentially becomes entangled with machines in the medical space. So this metaphor of machine, the rust-red engine, becomes very, very important. The air snags and eddies around them, the way a river snags and eddies around a sunken rust-red engine. They concentrate my attention that was happy playing and resting without committing itself. And again, the whole idea of the attention getting concentrated has a degree of violence about it. If you remember the beginning of the poem, the very opening stanza, we had this very strange line that I'm learning peacefulness. Right? So peacefulness doesn't become an organic, passive, peaceful existence. It becomes something which is acquired perhaps through drugs and needles and medication, etc. So there's a degree of violence and violent imposition that comes with peacefulness. We talked about later how she gets sleep and numbness through needles. Numbness, sleep, which are traditionally very abstract, phenomenal qualities, are perfectly quantifiable in this medical space, are perfectly purchasable in a way in the medical space. You know exactly how much sleep to give to the patient. You know exactly the mechanism of producing sleep in an artificial way to the patient. So in a way, again, those of you interested in medical humanities and the relationship of literature and medicine, very rich research, this is a very interesting poem, because what it says is quite essentially that the human body, the human being, the human self becomes deliberately and perhaps permanently problematized at the moment it immerses in a medical space. It becomes part man, part human, part machine, in a way which is perhaps irrecoverable. It can't recover the pure organic human self anymore. So the part of the healing process is also a part of the intervention process, intervention by machines, whether it's a transplant, whether it's an artificial heart, whether it's an artificial limb, a phantom limb which has been transplanted by an artificial limb. So all kinds of mechanisms are at play over here, and it becomes a very interesting entanglement. So the healing mechanism, the corrective mechanism, it requires a very direct intervention of machines into the human body. So to the point that the division, the boundaries between the human and the machine become blurred completely. You don't quite know when one ends, when one begins. So the rust-red engine becomes a very important metaphor of that kind of an immersion into a machinic existence from a purely organic existence. And we have, following that up, we have this whole idea of the attention being concentrated to the tulips. They demand the attention in a mechanical way. There's almost a trigger quality about this attention. The tulips come and trigger the attention. It's like switching on a switch. Attention becomes a mechanical performance which can be triggered by certain things, just like numbness. It's not an organic numbness. It's not something which is tiredness or ennui. It's numbness which is given to you, injected into you in order to make you something, right? So that whole idea of violently transforming you into something becomes quite dramatically evident. The concentration before, the attention before the tulips had come, was happy playing and resting without committing itself. So the tulips have now demanded attention, which was playful before the tulips had come in. So before the tulips came in, the attention was playful, it wasn't committing to anything. And that organic attention, that organic, playful, ludic quality of attention is now converted into something mechanical and forceful and perhaps violent. And now we have the final stanza where it has almost not just a claustrophobic quality, but a degree of infernal quality about it. It's almost like Dante's hell to a certain extent. The walls also seem to be warming themselves, right? So the walls are warming up around me. There seems to be some kind of explosion about to take place. And what explosion has already occurred once in the poem, at the very beginning, when she said, I have nothing to do with explosions. And the tulips become quite literally metaphors of explosion. All right. Now, what kind of explosion is at play over here. The walls also seem to be warming themselves. The tulips should be behind bars, like dangerous animals. The tulips should be forbidden. The tulips should be banned. They should be banned like dangerous animals. They're opening like the mouth of some great African cat. And we talked about this perhaps in a class before. The whole idea of some great African cat becomes important. On the one hand, we have the cat as a feline, domestic, recognizable animal, and we have some great African adding a sense of mystery and perhaps danger and exotic quality to it. And it ends up being an animal you don't quite know. It's some great African cat. So there's unknowability about the tulips. The degree of mystery and menace about the tulips gets heightened and dramatized over here, quite deliberately. So they're opening like the mouth of some great African cat. You don't quite know what it is. It perhaps is a cat, but it is like some great African cat, which you don't quite know, we can't quite classify as a human subject, right? So this whole combination of the domestic feline metaphor and the undomestic dangerous metaphor, ferocious metaphor becomes interesting over here. It's a very interesting combination between the homely and the unhomely, right? So some great African becomes the unhomely, the uncanny, something you don't know. Cat, of course, is perfectly domestic, something you know already, and something that you recognize as a human subject. So this whole idea between recognizability and unrecognizability is at play over here. They're opening like the mouth of some great African cat. And I'm aware of my heart, right? So this is a very interesting bit where we perhaps talked about this already, an example of hyper-reflexibility. You're aware of awareness. Again, a classic trope in embodiment studies. Those of you interested in embodiment studies might want to go down this direction. I'm aware of my heart. I become aware of my viscerality. I'm aware of the mechanisms of my heart, of my body, of my organ. And I think I may have mentioned this before. The whole idea of being sick, the whole idea of being ill, gives you a heightened awareness of your sensory self, of your sensory mechanism, of who you are, how your heart functions, etc. Things which you ordinarily take for granted, right? So it's almost like metafiction. You're aware of the mechanism of how things get done because things getting slowed down, decelerated and unsettled, right? And that slowed down, decelerated time, the whole slowed down, decelerated embodiment perhaps gives you a special insight into things which you take for granted ordinarily. So in other words, what happens, same with metafiction, the seamlessness of the performance, the seamlessness of the mechanism gets interrupted. And you begin to recognize the seams at play. You begin to recognize the mechanism, the apparatus. You begin to have an understanding of the apparatus at play because the seamless quality of spatio-temporal flow gets interrupted, which is a classic definition of metafiction. So the seamlessness gets interrupted, and that's how you recognize how narratives are formed. This is how narratives are built and manufactured and forged into existence. Right? Same with the body over here. When you become sick, when you become ill, when a certain quality of the seamless mechanism of the body gets interrupted, only then you become hyper-aware and hyper-reflexive in the sense of understanding certain things which you take for granted. And a very good essay to read about this, if you're interested in that direction, is Virginia Woolf's brilliant essay called On Being Ill. I mean, read it. It's a really good piece of work where she talks about how when she makes a comparison between the sick body and a city which has a strike, right? So when a city has a strike, everything shuts down. Then you recognize things which you don't normally notice, right? You recognize lanes and by-lanes and factories and little shops which you ordinarily pass by in a normal functioning day. But when a city has a strike, when the entire mechanism comes into an interrupted stop, a halt, a pause, it's only then you step back and notice things which you normally gloss over, right? So similarly with the sick body, on being ill, when you're ill, you notice things about your body, about your cognitive abilities, about your motor abilities, which you ordinarily take for granted. It's a really, really good essay. Do take a look if you have the time. So I'm aware of my heart. It opens and closes its bowl of red blooms out of sheer love of me. So again, the whole idea of recognizing the heart, understanding the heart, being hyper-aware of the heart becomes part of the visceral existence at play. The water I taste is warm and salt, like the sea. So it could be an allusion to tears, perhaps. It could be an allusion to the sense of loss which she has suffered, and comes from a country far away as health. So health becomes a country, health becomes a territory over here. And so the whole idea of territorializing health is interesting, because what that does is that it makes her an outsider to that territory. It makes her an outsider to that kind of existence. And again, those of you interested in critical theory and have this, unquenchable desire to apply theory to everything might want to look at Deleuze's idea of deterritorialization at work. Deleuze and Guattari will talk about deterritorialization. So that theory can be applied, and it has been applied by research students working in literature and medicine and biomedicine. It is a very effective and handy theory that I'm aware of. I do encourage students to go that direction, but you might want to take a look at that. Deleuze talks about deterritorialization. So what is deterritorialization? It's the experience of a known territory getting very dramatically defamiliarized, right? So that idea of territory, that idea of embodiment getting deterritorialized becomes very important over here, right? So the whole idea of a country far away as held becomes important, right? Okay, so the whole idea of health being a country, health being a territory from which she has been deterritorialized becomes very important over here, right? And the whole idea of deterritorialization is related to the idea of interrupted embodiment, the embodiment being interrupted, halted, defamiliarized. So that idea of deterritorialization and defamiliarization may be mapped onto each other in a very convenient way in this poem. So just to conclude, the water comes from a country far away as held. So held becomes a country to which she has become an outsider, and her outsiderness is something which is sort of deliberately dramatized over here in terms of a location. So again, location becomes very important. Location as a geography, location as a psychological quality. So all these things become very important, especially the way space gets mapped into embodiment in this poem. So she is located outside held, literally. She's in a hospital. She wouldn't be in a hospital if she were not located outside of held. And also she's located outside of held in terms of a psychological situatedness. The sense of loss that she suffered, the sense of trauma that she suffered, the sense of being deterritorialized that she suffered, and that gets dramatically described in this poem through very excellent use of craft, excellent use of metaphors, and excellent use of figurative language. So that concludes Tulips by Sylvia Plath, which is something we have done in relation to feminist writings, but I think I may have hinted enough in terms of pointing out directions through which you can look at the poem, even if you're doing research in related disciplines, not just feminist writings, but perhaps medical science and literature, perhaps critical theory, perhaps embodiment and literature, body studies, space studies, etc. So it's a very rich poem in terms of offering you a lot of research avenues that you can possibly explore. So we'll have a discussion on the poem now. So if I could just start with a generic discussion about why is this poem important in this course. So why would you think that a poem like this, Tulips by Sylvia Plath, should be anthologized in a course like feminist writings? What is it about the poem that makes it a very good pick for a feminist writing course? Very generically, and then you can move on to more specific descriptions. At a first reading, what does it offer you that you think might fit and do well in a course like this?
It gives us a female experience of alienation,
Right.
paranoia, and
Yes.
schizophrenia, like how that develops, how it alienates you from the everyday so-called normal surroundings.
Exactly, and it's a very female experience because, on one hand, there's a danger of essentializing experience, but on the other hand, the experience that she's had can only be experienced by a female, the experience of loss of a child, the experience of having a miscarriage, and the entire poem being born out of the experience becomes quite interesting. So the very premise of the poem is on loss. It's built on loss. It's built on lack. It's built on unfulfillment, and that loss, that lack, can quickly it translates. It extends into alienation. The experience of alienation gets heightened because of the embedded quality of loss that she carries within her. And again, we're back to discussing this loop between the embedded quality of embodiment and the extended quality of embodiment. The extended alienation is what she suffers with her surroundings. The nurses around her, the tulips around her, the whiteness of the doctors around her, that alienates her completely. But that's also dialoguing with the embedded loss that she has in her in terms of the miscarriage. And at one point in the poem, if you remember, which talks about two kinds of red at play, the red of the tulips and the red inside her, which is possibly pointed to the wound that she carries the physical wound, perhaps, of the miscarriage. But also it's quite dialogic in a very perverse way, perhaps, with the red of the tulips around it. So that's a very good example of how the extended alienation and the embedded quality of loss have become dialogic with each other in point. So that sense is a very female experience. And also, if you map a discursive study onto this, the speciality of the poem, you find that the medical space at play over here is very male. It's very much collusive with the state apparatus. It's very much collusive with the coercive state apparatus. And you can go back and connect it, do very rich research on the relationship between medicine, state, and the human subject, especially if you do studies in hysteria, for instance, and how hysteria was traditionally gendered into a female malady, very conveniently classified as a female malady, something which happens only if you have a uterus. Hysteria comes from uterus, there's a Greek etymology of the word, and there was nothing male about it, and the whole treatment of hysteria was a very male treatment, which was collusive with the state, the mechanism of the state. It entailed confinement, it entailed coercion, it entailed force feeding. Like for instance, if you read the biography of Virginia Woolf, you find there's instances of force feeding. Doctors force her into eating a certain quantity of bananas and milk every single day to give her strength, and confine her in a room in terms of not allowing her to write, etc. And also, interestingly, I think I may have mentioned this before, one of the celebrity patients of hysteria also happened to be Karl Marx's daughter, Eleanor Marx, who has written letters talking about how the great daddy is collusive with the doctors, right? So the great Karl Marx, the big daddy, is completely in bed with the doctors in terms of agreeing about the confinement techniques, in terms of agreeing with the coercion techniques that a doctor must go through. So it's very much a gendered treatment. It's very much the state, the male capitalist medical machinery taking care and correcting the interrupted female subject. So that kind of study does lend itself into this poem as well, in terms of how the human experience is described in this kind of a reified setting where everything is reified. The nurses are reified, the machines, of course, are reified, but also the human being is reified. The human being it converts from a human subject to a human object. Right? And this conversion to an object, which can be diagnosed, classified, tested, analyzed, examined, it becomes part of the painful process. It becomes part of the alienation mechanism that has been described over here. So yes, in that sense, it is very much a poem about female alienation, about an immersion into an unhealthy space. Ironically, the unhealthiness of the space is relatable to the medical quality of the space. Right? So that's an interesting correlation you can make. Any other point that struck you as interesting?
The trauma in Hooke's essay and
Pardon, the trauma in?
Bell Hooke's essay.
Yes.
The trauma and alienation she faced in her domestic space is
Yeah.
very much similar to the
True.
Trauma that Plath, in the medical space. So both home as well as state. So both how the state
Yes.
as well as family.
Sure.
It kind of trauma space. In
Absolutely. It's a very good point. And of course, we know that the home as well as the medical space both become examples of ISA as well as RSA. Especially the hospital can double up as the ISA as well as the RSA. So it's something which is supposed to cure you, but equally it can also punish you if you don't comply to the cure strategies, if you don't comply to the coercion strategies. Especially if you read the American novels of 1960s and 70s, which are very, very disturbing novels about the tyranny of psychiatry. Let's say a novel like One Flew Over Cuckoo's Nest. So it's completely about the terror of psychiatry, the terror of confinement, the terror of possibly cutting down the brain in order to make it better, etc. So that kind of strategy, that kind of coercion, that kind of violence is very much there in the medical space. And how does the human subject negotiate with that kind of space? So both become, you're quite right, both become part of the patriarchy package. The family where the human subject is corrected through value system, the family where the human subject is coerced into becoming a more complicit subject, more conforming subject, and then the medical space, which is a more extreme extension of that form of coercion through machines, through instruments, which can become machines of healing as well as machines of torture. And sometimes the difference is indistinguishable, especially if you read shell shock narratives. You find that the machines of healing and the machines of torture can often become one and the same thing, right? So electric shock, for instance, was a very common strategy of curing diseases. And of course, First World War soldiers. And of course, electric shock was a painful experience, but that pain was seen as part of the healing mechanism, right? So, yeah, so the home space and the medical space become equally important. And in a way, it's very dialogic, your quarter. It's very dialogic with the essay by Bell Hooks, because even there she talks about trauma as a permanent marker. Of course, in the Hooks essay, there is direct violence perpetrated by the Big Daddy, who becomes an agent of the state, correcting the non-conforming female subject into becoming more conformist in quality. So that degree of correcting the non-conformist is palpable here as well, right? So she has been corrected by the numbness of the needles. She's been corrected by the tablets which put her to sleep. She's been corrected by the claustrophobia in the room. So it all becomes part of the correcting mechanism, which obviously is quite violent in quality. Okay. Any other point? That's a very good point. Any other point that you thought was interesting when you read the poem? Any image that stood out for you in terms of this sheer power of viscerality, violence? With Plath, of course, I mean, it's hard not to do a biographical reading of Plath when reading her poem. I mean, it's not something that we should ideally do all the time, but a large part of our lived experience actually informs her poetry. So it is perhaps interesting and perhaps rewarding to look at a life experience in terms of how that lends itself to her poetry. We know that Plath was married to a celebrity male poet, Ted Hughes, who was a bit of a celebrity in a London circuit of that point in time. And interestingly, when Plath was writing her poetry, most of that was not published. A large part of her poetry is posthumous publication after she committed suicide. And we could do a very interesting reading of this female poet being consumed by the bigger male poet, who is more of the published persona, and that gives us, and connects to a very key thing in feminist writings and feminism in particular, the difference between the writer and the author, right? What's the difference between the writer and the author? It's the same difference between the cook and a chef. The writer and the author. What's the basic difference between the writer and the author? Is there any transition that needs to be done for a writer to become an author?
It's when a writer becomes recognized by the larger society that he or she is called an author.
Right, exactly. When the writer becomes an author, the very blunt way to read it is when the writer publishes in a social space. And by publishing, I mean the writer establishes a contract with the market in terms of getting a publishing contract and in terms of getting a book contract, etc. Only then a writer becomes an author. So it's partaking of this capitalist mechanism through which you can become an author. And that the life of Plath and life of Hughes is a very interesting example of how Plath remained a writer for a large part of her life because she was consumed and subsumed by the glamour of her husband. No one quite knew that she was a poet for a long time. And of course, we now know, if you compare Plath's poetry with Hughes' poetry, I personally feel it's chalk and cheese, really. I mean, Hughes obviously was a poet laureate, he got all the laurels, and then he was a glamorous poet, very much a big guy in the British poetry circles. Plath was an outsider, culturally, geographically, and also in terms of gender, right? And that idea of being an outsider keeps coming up in Plath's poetry. This is a voice which, once it gets heard, but then it's the voice of alienation, the voice of complete, being cut off from recognizability, from recognition, etc. And that brings us to some of the key things in feminist writings, including, let's say, something like agency, visibility, identity, recognizability. So these things become very important in feminist writings, especially if you look at Plath's poetry. So the whole idea of visibility in Plath became a posthumous condition. She became a big poet only after she died. And also, it's interesting, even when we discuss Plath in a class, we find that somehow or the other, hysteria becomes a big part of our understanding of her poetry, which again is a very stereotypical way of looking at a female poet. So people talk about how Plath killed herself, people talk about her depression, and as if that becomes a very organic part of her poetry, as if her poetry can't stand alone in its own right, due to his own craft, due to his own mechanism. So that again becomes a very convenient connection that we need to be aware of. That's why I said that we should be a little careful in terms of drawing too heavily on Plath's poetry in terms of looking at the poems. Some biographical details may be useful in terms of how that informs the poems historically, but then if you look at the poem entirely as the rant of hysterical woman, then obviously that does a great disservice to the craft of Plath as a poet. Right, so that also becomes something which we need to bear in mind, especially if you're reading a poem like this in a feminist writing course. Right, so the whole idea of being a female writer who did not manage to become an author, and who was perhaps always under the shadow of the authorship and the authority of the celebrity husband. Right, that becomes a large part of the way to look at Plath and the poetry today. Right, so that's something which we need to bear in mind as well. Any other point, any other image, any other idea that struck you while reading this poem? You might want to unpack a little bit. I mean, it's a very good study. Those of you who, if anyone's interested to write a paper on this course, that's a very ambitious aspiration on my part. But if there's anyone who wants to go that direction, a very good study would be to compare and contrast and have a dialogic relationship between this poem and Iraqi Nights. Right? Because both talk about the female voice in a condition created by men, right? A war created by men, in a medical space created by men, which is a space of surveillance, a space of agency-lessness, a space of loss of control. And loss of control, the loss of embodiment in both poems become literally a motor phenomenon. It affects you at a motor level, at a neural level, and of course at a more extended level. Right? Your navigation with your discursive apparatus changes. Little things like going to a grocery store, little things such as going to a school, to a market, these become accidents and miracles in such conditions. And the same as Plath away up. A little thing such as a heartbeat, the idea that she still has a heartbeat becomes a matter of euphoria for her. The fact that she can recognize her beating heart gives her a message of perhaps of optimism, perhaps of hope at this point in time. So again, you can connect both poems with the wolf theory of the strike. Right. So what happens when a strike happens, when things slow down, things get defamiliarized, the mechanism stops. So if you look at the body as a city and the sickness as a strike to the city, it's a very interesting analogy that you can establish through that kind of reading. So do read Wolves on Being Ill, because I think it's a very seminal essay which will help us understand a poem such as this. And if you have any more points to discuss, we can obviously come back later and have another interaction. But with that, perhaps it's good to end the session, and we end with Sylvia Plath's Tulips.